Approximately 13% of women of childbearing age are suffering from polycystic ovarian syndrome. Today, we are going to look at some of the causes of PCOS, how we can treat it, and how it is affecting your fertility. Welcome back to my channel. My name is Dr. Raisha, a pharmacist and a fertility and women's health expert. If you are new to this channel, please do not forget to subscribe and hit the notification bell down below. So today we are going to look at PCOS. PCOS stands for the Polycystic Ovarian Syndrome. I want you to know that PCOS is characterized by many fluid-filled cysts in the ovary. It is also characterized by abnormal production of androgens. Please note that androgens are usually present in a woman's body but in small amounts. But in the case of PCOS, there is abnormal production of androgens. So, what are some of the causes of PCOS? PCOS could be caused by high androgen levels. It could also be caused by insulin. This is whereby we have high insulin levels in the blood. That is diabetes. It could be caused by diabetes, but also it could cause diabetes. Another thing that could cause PCOS is family history. This is whereby you find a first-degree relative of yours having PCOS. And so, I want you to look keenly here so that you can understand how PCOS affects the body and some of the signs that PCOS has. So, we're first going to look at something called the HPO axis. So, the HPO axis stands for the hypothalamus, pituitary, and ovary. This is the axis that regulates the menstrual cycle. So, it is usually like here we have the brain and here we have the ovary. So, in a person without PCOS, a non-PCOS person, we have the brain and the ovary. And so, the hypothalamus part of the brain and the anterior pituitary releases the gonadotropin releasing hormone. The gonadotropin releasing hormone then sends signals to the anterior pituitary instructing it to release luteinizing hormone and follicle stimulating hormone. Luteinizing hormone is the hormone that regulates ovulation. Follicle stimulating hormone leads to the development and maturation of follicles. Here in the ovary, it has a lot of follicles. And each follicle consists of one egg. All these follicles are immature. And so the follicle stimulating hormone sends signals to the ovary, to the follicles, telling them to grow and to mature. And so the follicles start growing and maturing. At the same time, they are releasing estrogen. And so when there is enough estrogen, it sends signals back to the brain, instructing it now to reduce the level of follicle stimulating hormone and now to release increased amounts of luteinizing hormone. And this is whereby you find an upsurge of luteinizing hormone leading to ovulation. But this is in a non-PCOS person. What about a person with PCOS? So this person So for a person with PCOS, their ovary has a lot of cysts, fluid-filled cysts, which are found at the edge of the ovary like that. Right? And so when gonadotropin releasing hormone sends signals to the anterior pituitary gland, they release luteinizing hormone and follicle stimulating hormone. Follicle stimulating hormone now sends signals telling the follicles to grow and to mature. But when this signal is here, it is blocked. It does not pass there. and so there is no release of an egg. There is no ovulation. I also want you to note that the ovary releases progesterone and estrogen. We saw estrogen being released before ovulation, and after ovulation, now it releases progesterone. And so now this signal has been sent and it has been blocked. So there will be no development or maturation of the follicles, and hence there will be no release of a mature egg. So estrogen is usually released before ovulation. Progesterone is usually released now after ovulation, after formation of something we call the corpus luteum. So there are now very low levels of progesterone. So progesterone usually sends signals to the hypothalamus regulating the release of gonadotropin releasing hormone. But now in this case of this woman with PCOS, there is no progesterone. So it does not send signals to regulate the release of gonadotropin releasing hormone. So this woman now starts releasing gonadotropin releasing hormone in increased amounts. And now this offsets the balance between luteinizing hormone and follicle stimulating hormone, where you find out that this person starts releasing luteinizing hormone in very high amounts compared to follicle stimulating hormone. So the ratio of luteinizing hormone to follicle stimulating hormone is not equal. So they release a lot of luteinizing hormone and decreased follicle stimulating hormone. So this person, after releasing a lot of luteinizing hormone, it goes now to the ovaries, leading to the ovaries releasing increased amounts of androgens, such as testosterone. These are such as testosterone. And so when this woman releases increased amounts of androgens, this now leads to something we call insulin resistance. Insulin resistance is whereby now the insulin cells do not recognize insulin. They are unable to take in insulin. So there is a lot of insulin in the blood, but it cannot get into the cells. So the cells are like, we are not getting any insulin. Let us produce more insulin. So insulin resistance now leads to increased production of insulin in the blood. And so when there is increased production of insulin, now this leads to increased androgen, and it is a cycle just like that, just like that. And this is whereby we are talking about a person with PCOS getting something we call type 2 diabetes. Why? Because of increased insulin levels in the blood and increased insulin resistance. Again, a person with PCOS has increased levels of androgens. These are the male hormones, and this is what causes acne and also causes excessive hair growth. So you find this person has excessive growth of hair or even beards as a woman. And so that is how PCOS occurs. And when you go to your doctor, the doctor uses a diagnostic criteria called the Rotterdam criteria to diagnose PCOS. You usually look for 3 things in that criteria. Number 1, they will look for irregular menstrual cycles. These women normally get irregular menstrual cycle due to hormonal imbalances that we have seen here. And so we find that this woman's cycle length is more than 35 days. We said that a normal woman has their cycle length between 21 days to 35 days, but you find that in a person with PCOS, their cycle length is usually above 35 days. Again, you find that they have less than 8 or even less cycles in 1 year. Again, they usually look for the male androgen levels. We have seen that the male androgen levels are very high, so they will look at their high levels of androgens in this person's blood. And we have seen some things that can result from increased androgen such as acne, excessive hair growth, and even increased insulin, which could also lead to diabetes. Another thing that we look at is we do an ultrasound scan. And in the ultrasound scan, we are looking to see, are there any cysts in this person's ovary? And so, how does PCOS cause infertility? We have seen that most of the times these women do not ovulate. We have also seen hormonal imbalances in the body of this woman, and hence this can lead to infertility. And so, how do we treat PCOS? The first line of action in the treatment of PCOS is usually lifestyle modification. So, what do I mean by lifestyle modification? Exercise. Why are we exercising? To lose weight. Most of these women with PCOS, not all, but most of them are usually obese. So the first thing is to lose weight. And the second thing is to lose weight. You have to lose weight. So exercise and dieting can really help to lose weight. And when you lose weight, this can really improve the signs and symptoms of PCOS. This is usually the first line of treatment for a person with PCOS. Another treatment option for a woman with PCOS is the combined oral contraceptives. These combined oral contraceptives help improve the periods of women with no periods, and they also help regulate the periods of women with irregular menstrual cycles. You also find that they reduce the excessive hair growth in these women. But we usually find that when this medication is stopped, the signs usually come back. You find now that the irregular menses come back and the excessive hair growth come back. Another thing is controlling the glycemic abnormalities. We have seen that this person has increased insulin in the body, and this can lead to type 2 diabetes, so that we usually treat with drugs such as metformin. Another thing is infertility. The infertility that could arise from PCOS, we could bring in drugs such as clomiphene. Another thing is the increased androgen levels, and these can be controlled by use of drugs such as the combined oral contraceptives and also metformin. And there you have it, guys. I hope you have understood PCOS, what is causing PCOS, and how we can treat PCOS. If you like this video, please do not forget to give it a thumbs up. And if you have not subscribed, please do not forget to subscribe and hit the notification bell down below.